complaining that I was having some vision problems, especially in my left eye. Was unable to read the top letter on the eye chart, which is the big E. It was blurry, and I literally could not see it with my left eye. The year before that, I had no problems reading the big E.
Oh. Hello, today you're going to hear the story of Patrick Bollmeyer. Now, a year earlier, he saw his eye doctor and he could read everything fine. There was no concerns. However, when he goes to the eye doctor this time, he can't even see the letter E on the big eye chart. That's incredible. That's a distinct change. His eye doctor sends him to the neuro-ophthalmologist. The neuro-ophthalmologist confirms that it's not from diabetes, so they get an MRI. It shows a tumor in the tuberculum sella. He's referred to a neurosurgeon in his local area, who then refers him to me for specialized skull-based surgery. Now, the interesting thing is I could have removed this tumor through the nose, which is an advanced technique that I trained under the progenitors, the creators of this type of surgery. But because of the distinct anatomic concerns, I chose to come at this tumor through a standard craniotomy, and everything went beautifully. What we're finding is that patients can have vision problems, and that's not an eye problem, but it really is a brain tumor. And because these brain tumors can be very slow growing, it can come on insidiously. And I thought I'd have Mr. Bollmeyer tell his story from over 2 years ago.
Yes, a little over 2 years ago, I went for my eye exam with my ophthalmologist, like I do every year, and complaining that I was having some vision problems, especially in my left eye. Well, when we went and to look at the eye chart, I was unable to read the top letter on the eye chart, which is the big E. It was blurry, and I literally could not see it with my left eye.
So that's really remarkable to me, because I remember, when I get my eye tests, that's the easy one to do, and I'm sure you had the same.
Yes, exactly. And the year before that, I had no problems reading the big E.
Oh, so and you didn't have any pain though?
No pain at all.
Wow. So yeah, that's really remarkable. This tumor can grow fast enough that a year ago it wasn't causing a problem. But I've also seen sometimes that happens and the tumor is actually not that dramatically different. Sometimes we what I say is that it's the camel or the straw that broke the camel's back. It just grows just enough and it pushes your nerve over the edge. And then what happened? Your eye doctor sent you to...
My doctor sent me to a specialist within their practice to see if it was related to diabetes. He examined me and he assured me that my eye, the left eye, was healthy. That whatever was going on was behind my left eye. So they recommended I go see a neurosurgeon. And my family doctor, I guess, originally told me to get an MRI done. Had all that done first, then I went and saw a neurosurgeon down at a practice in Delaware. And from that point on, they looked at the pictures, and they recommended me to you, Dr. Lee, for the surgery. They said, you've done a lot of these, and so they felt very comfortable recommending you.
Yeah, and I always thank my referring neurosurgeons and the practice over in Delaware, because I've been here 18 years now, and so with that I've been able to develop a good reputation and do good work. And but yeah, that must also have been scary, that they can't handle it over here. You got to go to Philadelphia.
Well, it was almost a blessing in that you want to get the right person to do the surgery. And they highly recommended you because they know that you have done so many of these. And yeah.
Excellent. And then when I described the surgery to you, where I have to make incision and cut and come on under your brain, what were your thoughts?
Well, it's a little intimidating, but I knew that if I did not have the surgery, that I had the chance of maybe losing vision in my left eye permanently. So with that in mind, it's the lesser of the two evils. So it was the surgery was scheduled pretty quick after all this was decided on, and so everything has turned out fine by now.
Now, so for this patient, Mr. Bollmeyer, he has a meningioma. Meningioma. They grow slowly, They're benign, and location is paramount. Where they are located is extremely important. So in this situation, the location is what we call the tuberculum sella. Now this is complex, tuberculum sella. The sella is where the pituitary gland sits. Now that's not that important in this case because the pituitary gland is here, there's a stalk, but what's more important is just above the tuberculum there is something called the tuber. And this tuber, it's a protuberance that sticks out when you look from the top of the skull. And in that case, the tumor arises from here. And what is sitting above the pituitary is your optic. And so the optic is important. So let's keep going. Now, in this situation, he has, if you look at a side view of his head, and I am not an artist, but here is his nose, and here's his lips, and the cerebellum would be here. The pituitary gland sits here, but going to his optic are these optic nerves, one for each eye, and the optic chiasm, which is the X, sits just above the pituitary gland and just above this tuberculum. Now remember that tuberculum is where this tumor originates, and so it can push on his optic nerve and his optic chiasm. And so that's what we're interested in. So in his case, his brain is sitting up here. I can come in different ways. The standard approach, time-honored, is to do what I did, which is to come above his eye and under his brain to tackle the tumor. The other approach would be to come through his nose to tackle it this way. And I am facile with both approaches because I trained at the University of Pittsburgh, which is where the endonasal approach started. But there are certain features of why I did not do it that way. When we look at someone like this, and he's got his, and I look at his hair, I try to hide the incision in the hair. So I take my incision right to here and I hide it in his hairline. And then the surgery is done above the orbit. I remove this bone and then put that back when I'm done and then come in. So you'll see a lot of my patients, they have a thin strip of hair shaved right where I cut, but then otherwise they look great. So I hope this helps understand craniotomy, which is where I am cutting, versus going through the nose, which we call endonasal.
Great. And then after the surgery, when did you notice that your vision had improved?
Probably within 24 hours. I did the old thing where I was covering one eye, covering the other eye, and I could actually, certainly I could read the big E if I needed to, but I was able to read, a book or the headlines on a newspaper, something on the computer. I had no problems at all. I'd say I got at least 85-90%, I would say, of my vision back in my left eye right away, and it's improved, I guess, as the swelling internally subsided, and it got better, and it's very good right now.
So the vision improved within 24 hours. And did you have any pain or anything bothersome?
That's the remarkable thing about this whole process. From the time I was referred to you from the ophthalmology department down in Delaware to up here at Penn, I had no pain before surgery. I had really no pain after surgery. The worst pain I had was 2 weeks later when they removed the staples out of my head. That was the most pain that I had. Other than that, as far as inside, like with headaches, this and that, none at all.
That's
Oh.
great. What I generally think is that pain is proportional to how much muscle we have to move for the
Yes.
surgery. So when you do back surgery or hip surgery, I think you got a lot of muscle, and so that's always pulling on things. Whereas surprisingly, people can do very well after brain surgery.
Yes, it was remarkable. At this point in time, the only time I ever had surgery was when I was 3 or 4 years old and had my tonsils out. So this was my first surgery since that point in time, 65 years later.
That actually is remarkable.
So I went from tonsils to brain surgery. So,
But it's good you avoided us surgeons. That's very
Yes.
smart.
no, but it was a great outcome. But I was very surprised that no pain before, no pain afterwards. I wanted to become active again around the house. In fact, my wife could attest that there's nothing that was stopping me. I was up and at 'em, ready to go. So yeah.
I've been making these YouTube videos now for about a month, and you can really help my channel if you just hit the link and subscribe. Please watch the videos. I think this is going to really help patients.
Yeah.
Well, this is great. This is 2 years later, and now we're seeing a small little thing, but it's actually not even in the brain, so we're just going to watch that.
Yes.
So, what do you look forward to the most with your retirement?
Traveling, spending time with, we have 7 grandchildren. They keep us busy. They're growing up and they're getting ready. One of them's getting ready to graduate high school. And the youngest one is 6 or 7 right now. So that's what we're looking forward to.
That's great. And you can see them.
Yes, fortunately, they all live very close to us. So, yeah, we're fortunate.
It was just a pun. Okay. All right.
Okay, you want me to
No, it's very good.
I can see them with both eyes, right?
Yeah. All right. Well, very good. Thank you so much.
You're welcome.
All right.
Thank you.